Dump those spectacles. Regain clear eyesight. Seriously.
See any cases, once they start with the glass, number will keep increasing.
Absolutely.
Every 6 months they will call back you.
Very true.
And number 0.5, 0.75 they will increase.
Correct.
The cause of the increasing the number of the glass, what I am seeing, is glass itself only. Because once you start the glass, your eye muscle not need to be worked. The muscle will completely depend on the glass.
Correct.
Muscle will day by day, week, number increases.
Hi, I'm Satish Rao from Pro Holistic Health. Listen into my conversation with Dr. Padmalochan Jena, consultant Ayurvedic physician at the Sri Sri Ayurveda Panchakarma Center. For more information on alternative treatments and wellness tips, subscribe to the channel www.proholistichealth.com. Dr. Padmalochan Jena, welcome to Pro Holistic Health. Good to have you here.
Yeah, thank you.
Dr. Padmalochan, I hear that you see a lot of cases of children having eye problems, ophthalmic problems. And what are typically the cases that you see with children and their eye problems?
Yeah, children are mainly started with myopic number, myopia, that is minus number. Some of the cases of the children by birth, it is lazy eye, one of the eye is lazy eye. Some of the hypermetropic, that is plus number, started with the plus number. Some nystagmus, that's shaking of the eyeball. These are the majorly children's coming to me. We are taking care naturally through the holistic treatment through Ayurveda and eye exercise.
So how different are you in terms of your treatment to these children for these conditions, especially myopia? We see a lot of children with those glasses and year on year their number keeps increasing.
So myopia, you can see if any eye hospital you will go, you will be see they will give the start to the glass.
Absolutely, correct.
You can see if you see any cases, once they start with the glass, number will keep increasing.
Absolutely.
Every 6 months they will call back you.
Very true.
And number 0.5, 0.75 they will increase.
Correct.
The cause of the increasing the number of the glass, what I am seeing, is glass itself only. Because once you start the glass, your eye muscle not need to be worked. The muscle will completely depend on the glass.
Correct.
Muscle will day by day, week, number increases.
Yeah.
Second biggest problem with the glass is that what glass they give him is fixed in 6 meters.
Right.
But they will tell you always wear the glass.
Correct.
So the 6 meter glass children are used for reading and writing also.
Yeah.
So once that far glass used for near object, that will more strain the eye muscle and increase the number. Third, your eyeball movement will stop.
Right.
Once with glass, if you want to see some side object, you have to turn your head.
Correct.
Without glass, you can move your eye immediately. Around 80 to 90% eyeball movement stops by wearing the glass. That also strain your eye muscle and increase the number. So your starting glass means you are encouraging your problem. You are not solving your problem. Problem with your muscles. You should treat the muscles.
Yeah.
So all the exercise what we designed here, around 12 varieties of exercise we designed, and around 12 to 14 varieties of treatment, some massage, some packs, some dharas, some extract we will keep on the eye to strengthening the eye muscles. So that process, the power which is increasing, that is coming down, gradually coming down.
So doctor, typically for a child, how young child can be brought for this kind of treatment? How soon they can be brought for this treatment?
See, we are starting from treatment actually, what we are 7 days, 10 days process on residence course. This we start after the 5th only.
5 years.
Once they learn the later only they can start the exercise.
Right. So are they for the cases where there is a condition, where there is a hereditary condition or likelihood that a child will get for those kind of conditions, or?
Yeah, hereditary nowadays, see, this who parents have glasses, now children have glasses due to genetic pool.
Yes.
Because once the parents are wearing glass, how it's come genetically, now our lifestyle is closed in a very limited area. For example, when you wake up in the morning, go to the school, office, work in table computer, come to home, watching TV, sleep down. We have no time to look to some far object.
Yes.
We forget about the star and moons. And our lifestyle is very close. Every work is closer.
Yes.
That is due to that. Our vision is limiting.
Got it.
Eye is not going too far.
Yeah.
That is another factor. Is passing generation to the next generation, our far vision getting weak.
Okay.
So that's why if parents have glasses, it's coming to the next child also.
Okay.
gradually our vision is limiting, very
Absolutely.
limited area.
Yeah.
Now there's a flat lifestyle. You cannot, if you look through your window, you will see another flat.
That's all.
No sky.
No sky, absolutely.
So our vision is limiting in a very limited area.
Very true, very true.
That is limiting our vision. That is starting also power. If genetically not there, also children are starting number like that. Whole day they are inside room only, watching tabs, TV, mobiles.
Yeah.
Vision is limiting to near only,
Yeah.
not going to far.
Far at all.
That is a very important thing.
Yeah.
Vision take to far,
Yeah.
then your far problem will solve.
Yeah, yeah.
So that is not there nowadays.
Very
so
well
limiting,
thought.
vision is limiting. That is more starting with the far problem. For far we need the glass to see.
Yeah.
That is the thing.
Okay, so the more and more the muscle gets weaker and weaker,
Yes, yes.
and it gets into a cycle where you can't come out of it.
Yes.
Okay.
That is the thing. Generally 0.5, 1 number will come down in every 6 months. That much number is surely come down, whatever age limit maybe.
Okay.
But we are getting very fast result within the age of 21
Okay,
because growing stage.
right.
That is very fast result, fastly power will come down. After 21, body growth is stopped.
Ah,
Improvement is little slow.
okay.
But after 40, who have reading number, that also we are getting very good result.
Oh, yes. If they come for a residential program of 7 days to 15 days,
Hmm.
after that they can follow their routine at home?
Yeah, we
And
give
learn?
all the kids for all the exercise.
Okay,
We'll teach correctly, so they will practice in the home
Very
with
nice.
their kids.
okay.
So then every 6 months maybe we are call once
Yeah,
to one more phase of treatment.
right.
So then gradually, which is 0.5 increasing,
Yeah,
that will 0.5 reduce.
very good.
That in deep way, very natural way.
Very nice. And typically, how many times do you have to come here?
Depend upon your power. If
progress.
it is 1-2 number, maybe 1-2 session.
Right, right,
If 10 number,
right,
maybe 5-10 session is needed.
right.
Depend upon your power, what
Power.
is your age.
And besides this exercise and the aid that you're giving for them to do the exercises, is there any medications also prescribed to them?
Yes, sure. We have very good medication with some herbal mineral medicines.
Yeah.
So they are helping lot to strengthening the eye muscles.
Okay.
See, previous days, if you remember, kings are taking food in the golden pot.
Hmm.
Little gold should go to your
Hmm.
body. Gold and silver is the best nervile tonic.
Hmm.
Now, science also proves it's a trace element repair for our body.
Hmm.
So those preparation medicines we have herbal minerals medicine that we are giving more importance for the eyes because eye or retina is a part of nervous system.
Hmm.
Rod and cone cells which is mainly responsible for vision.
Right.
So those medicines are working very nicely
Right.
for the children, other people also.
Can you give any suggestions to parents as to what advice and what kind of regime they should prescribe to their children to ensure that their eyes are healthier in simple routine ways, because they cannot do anything drastic, but in their lifestyle that there is there, with a little eye to detail and with a little awareness, what else they can do for their children?
See, nowadays parents are very busy lifestyle,
Yes.
but what they are doing, giving the gadgets to the children
Yes.
if they are out.
Yes.
TV, gadgets, mobiles, all these things, that is very, very harmful.
Yeah.
What I am telling, if you can see if a child playing on the screen,
Hmm.
something is moving inside, they are also moving from outside. Hour, they are playing high bright light.
Yeah.
The latest research telling that due to using or playing long time on the screen, your stress anxiety will be more, destructive mind will more develop in the children.
Yeah.
Memory power are getting weak by children. And a lot of children are starting glass due to playing on the screen.
Yeah.
Lot of indoor, outdoor games are there, badminton, table tennis, basketball, carom,
Encourage.
chess.
Yeah.
Physically, mentally make them healthy.
Yeah.
They should habit to those type of games.
Correct.
But don't allow to play on the screen. That is my request for the parents.
Right.
They should not allow the screen. Alternative something with him,
Correct.
but don't give the gadgets.
Right.
At least this radiation is very, very dangerous.
Right. So the more they encourage them to go out and take part in
Yes,
activities and
outdoor activity,
games,
yeah,
it's better.
yeah, that is better.
Better.
Yes.
Yeah, some serious sports also is good,
Yeah.
and physically also it's very good, strenuous,
Physically, yes,
and also
that's
at the same time it gives you a
Yeah,
a
mental,
different
physical
mental.
health.
Yeah, absolutely. For the adults and for parents and for elderly, that is grandparents, if they have to take extra care for their eyes, can you suggest some preventive
Diets.
methods, diets and methods?
Diets, methods, yes.
Yeah.
See, diet have very important role. What I'm seeing, that lot of people habitate with the processing foods.
Hmm.
Processing food contain lot of preservatives.
Yes.
Preservatives is nothing, it's insecticides.
Yeah.
Insecticides, we have a eye blood barrier, what is there? There is a membrane. What food we are taking, it's mixed in the blood,
Yes.
but it not enter into the eyeball. If it is enter, your eye vision will finish.
Yeah.
But these preservatives are such a minute particle, it can enter through that membrane. So that is damaging our eyes. So what I am telling you, processed food don't take.
Right.
Food which contain preservatives. Before taking any food, see what is the composition or ingredient of the food. If some preservatives is there, don't take. And fresh food, generally I am advise my patient to take the gajar, carrot juice every day. It's contain very rich of carotene.
Yeah.
It can directly enter into our as a rhodopsin pigment, convert into rhodopsin pigment inside our road cells. It improve your night vision very nicely. I advise to take the patient to take the almond. Almond is, the shape is like eye, you can see.
Yeah.
Nature make it like eye.
Right.
It's very good for eyes, rich of vitamins A and very easily digestible protein.
Right.
It's very, very good for our eyes.
Right.
And some all color fruits you can take, like papaya, you can take the pomegranate, you can take the tarbuja, and even oranges. All these things, color fruits are very helping for our retinal cells also. So fresh fruits, salads must be there in your diet every day. Instead of processed food, boiled food also less, but salads, fresh foods, some sprouts, those will definitely help to improve your eyes.
You had a very interesting take about glaucoma and also about cataract.
So you should not go for operation, as for my opinion, till your vision is not blurry or cloudy. But if you come to us before, you not need any operation. We are taking care naturally through our treatment and exercise. See, if you operate the cataract also, your vision will be not 100% comfortable. See, the natural lens which is contract dilate, when you looking far become thin, looking near it become thick. So how much naturally you should maintain? You maintain through our exercise and through our treatment. As per Ayurveda, is a Pitta Kapha imbalance. So we are treating accordingly. We are selecting such a beautiful herbs for the cataract. It is working very fantastically. The cataract will be in 7-10 days. People are seeing much clear vision. What you able to read 3-4 lines, they are reading extra in far also with this our treatment. So
Dr. Padmalochan, thank you very much for your time. It's been a pleasure talking to you, and it was very interesting, and the perspective is very, very interesting.
Thank
you. Sri Sri Tattva Panchakarma is a global brand established under the flagship of Sri Sri Tattva, with a clear vision to bring the best of Ayurveda to the world under the guiding light of Gurudev Sri Sri Ravi Shankar. Aligning to this focus on Ayurveda, various techniques of yoga and meditation, as well as some highly effective alternative therapies from around the globe are integrated to create an oasis of peace, serenity and wellness. Do like, share and subscribe to the channel. Thank you.